I was practicing medicine for many, many years, and travel medicine was something that even I, as someone who's was board certified in internal medicine and practiced in pulmonary and critical care, I didn't know what travel medicine was really, because even primary care doctors are not exposed to travel medicine formally in most trainings. And there are really some don't even know that it exists. I think the most common thing when you go see your primary care doctor and you say, hey, I'm going to a developing nation, I'm going to Africa or somewhere in South America, the advice they give you, oh, just be careful and don't drink the water. That really is not travel medicine. And I think part of it is getting education out there, both for the general public who travel to developing nations, as well as primary care doctors who either have to sort of acquire those skills on how to treat patients with travel medicine, as well as refer them out to a travel medicine expert. So I think even letting people know that there are travel medicine clinics and travel medicine experts is probably part of the struggle. I think there are many, many people who don't know that travel medicine exists. I think they don't understand the Center for Disease Control and other healthcare specialists recommend you see a travel medicine expert before you go to many countries around the world. There's many things that have to be done in a travel medicine consult, and I'm going to go over that. So my goal today is to educate you and even physicians and other healthcare workers about what travel medicine really is, and how it works, what you can expect when you get a travel medicine consult. So let's take it from there. Let's first start out with what is travel medicine for? I mean, when do you need to see a travel medicine expert? So let's just be clear. Based on what the CDC recommends, you probably need to see a travel medicine expert if you're going to many of the developing nations in the world. And there's a reason for that. And by developing nations, I mean many parts of Mexico and Central and South America, as well as Africa, certain parts of the Middle East, and certain parts of Asia. All of those constitute the bulk of where you're going to need to see a travel medicine expert before you go there. The reason for that is there's several vaccines that we give often when people go to developing nations. So, and I'm going to go through that, and so you better understand what those vaccines are and why you may need them. But also there is this component of prescriptions that you need for some of those locations. And the last component is counseling and advice on how to minimize your risk while you're in these locations. So this would what a travel medicine consult would entail. So if you were going to a developing nation, you would go see a travel medicine expert, and their job would be to understand your itinerary, where you're going, and then based on your itinerary and what you're going to be doing and how long you're going to be in one of these nations and which part of those countries you're going to be going to, what activities you're going to be doing. The travel medicine expert's job is then to come up with a strategy to maximally protect you. And all the things I talked about, which country you're going to, which part of that country you're going to, how long you're going to be there, what kind of accommodations are you going to have? Are you going to be in a hotel? Are you going to be staying with locals? It actually changes your management. The kind of activities, are you going to be staying at 4 or 5 star hotels, or are you going to be, working on, a medical mission or a church mission where you're going to be more in local communities, maybe out in rural areas? All of that will determine the precautions and vaccines potentially that you may need to take, and prescriptions.